Let's face it, the traditional private practice model is becoming increasingly unsustainable for many physiotherapists. Shrinking reimbursements, growing paperwork, and rising operational costs are taking a toll on our profession. Health insurance is a funny love-hate relationship where patients pay those premiums month after month, year after year, and yet getting a claim approved feels like pulling teeth. Insurance companies use tactics like delaying in payments, denial of claims, and forcing appeals that are time-consuming. It's a game that earns them profits, and the patients and the physios get stuck in the middle. It's us, the physiotherapists, who have to face the reduction in the number of sessions or the types of treatments provided. This is why I've come to the conclusion that capitalism and private pay insurance isn't working here. But what if I told you there's a way to turn the tables and build a thriving practice despite these challenges? It's the physician clinic model that represents an innovative solution that's both unpopular and inevitable. As physiotherapists, we're no strangers to hard work and dedication. However, the current landscape calls for more than just effort. It calls for efficiency in operations, streamlining our processes, and a relentless drive towards better patient outcomes. But we're building healthcare, not cars. I know it can feel overwhelming to think about change, especially when we're already stretched thin. This physician clinic model represents the inevitable shift in how we are going to have to provide our physio care in the future. It's more cost effective for physios to see more patients. Insurance companies and governments will force us to start doing more patients for less income. If you think somebody's going to give you more money because you're such a great therapist, then I'm sorry to be the one to tell you that that money isn't coming. Start thinking about how you can innovate your own practice. We have to be open to new ideas before we're financially squeezed out of our current position. Take the first step today. We have to ride the wave of change like a surfer, dude. I know you're struggling to decide right now if you should click off this video or keep watching. Let me help you decide by telling you what we're going to explore next. Crucial topics that'll help you flourish as a physio ready for the future. Here's a sneak peek of what we're going to cover. Adapting to the declining physio reimbursements in a changing landscape. With insurance reimbursements rates declining, the physio profession finds itself at a financial crossroads. But if we embrace nationalized healthcare and shift towards an unpopular business model, then we'll ensure long-term viability of physiotherapy as a profession. Easy, right? By adopting efficient workflows, leveraging team strengths, and prioritizing patient-centered care, physios can navigate these changes and deliver exceptional care to our patients. The physician clinic model, teamwork makes the dream work. In the physician clinic model, the physio leads a team of skilled assistants in delivering effective and efficient patient care. In this model, priority for patient outcomes has been ensured by leaving all the routine tasks to be delivered by support staff, keeping the physio free for complicated interventions like educating patients and doing manual therapy. Using standardized protocols and effective communication and regular quality checks, we can ensure that this high-volume clinic delivers quality care. Thriving in a changing world, 4 essential strategies for physios. Healthcare is a complicated business and it requires physios to focus on high-impact interventions, that's the 80-20 rule, active exercises and patient education, simplify your approach, and use teams. The bonus section, debunk the physio mill myth, how high-volume clinics can still deliver quality care. High-volume physiotherapy clinics can achieve quality care through efficient systems, team-based approach, and patient-centered strategies. Such clinics focus on active rehab exercises, clear communication, and continuous quality improvement to balance efficiency with personalized care for the best patient outcomes. So let's dive right into the first challenge, the declining reimbursement rates that are shaking up the physio world. The only constant is change. By embracing these changes and adapting to our approach, we can ensure a bright future for our profession. Improvise, adapt, overcome. Section 1, adapting to declining PT reimbursements and changing physio landscape. We're at a crossroads in the financial landscape of physiotherapy. The decline in insurance reimbursement for physio service is alarming. Insurance companies, let's face it, they're not always on our sides, and they perfected this strategy of delay, deny, and defend. It's like some sort of corporate chess game at which every turn they have a counter move. They will delay payments of valid claims, outright deny some bills, and then take us to court if we have the audacity to oppose them. In this process, the frustration and the consumption of time can drain our energy. And yet we must be prepared for the challenges ahead. I've experienced this frustration and uncertainty of insurance coverage firsthand, and I'm sure many of you have too. Let's face it, the current state of physiotherapy can be overwhelming. Insurance companies tightening their purse strings, reducing covered sessions, and making it harder for us to provide the care our patients need. But wait, there's more. We can't just bury our heads in the sand and wish for it all to get better. We need to step back, see the big picture, and try to understand how we can adapt. We're all dealing with an increasing cost of living, inflation, and growing healthcare needs. Buckle up, things are going to get interesting. But I'm willing to bet that a shift towards nationalized government-run healthcare is on the horizon. Now, some of you might be thinking, won't that mean long wait lines and bureaucratic red tape? Yes, those are valid concerns. However, I believe that a well-designed national healthcare system can actually improve patient outcomes, reduce costs, and increase access to quality care because it's worked in other places. Think about it, a two-tiered system can work. There can be those who can afford private care and still accesses, while the majority of people can rely on a robust public system. And let's not forget the U.S. already has a form of nationalized healthcare through Medicare, Medicaid, and the Veteran Services. No system is perfect, and what we have won't last. But I'm hopeful that since we can learn from existing models and work out a compromise, I told you this was going to be unpopular, we all know how frustrating the current healthcare system is, especially when it comes to paperwork and payment woes. I've been in your shoes, trust me. I remember feeling like I was drowning in paperwork, wasting time that it could have been spent helping patients. But here's the thing, you're not alone. And this is why I wrote my first book, to share my success in note writing efficiency. It's a total game changer, and I'm not just whistling Dixie. Now, to the value-based care models, they sound terrific, right? Patient outcomes over service volume. But the thing is, if we fail to clearly document those outcomes, we may see reduced payments. Remember the efficiency in note writing? These changes will have far-reaching repercussions. For providers, it can add stress to the financial viability of their physiotherapy practice, leading to staff reductions, service limits, and closed clinics. For patients, this could mean higher out-of-pocket costs or reduced access to the physiotherapy services. I recall one insurance company that covered only 8 physio visits regardless of the injury. The implications for private physiotherapy clinics are huge, and with many struggling to stay afloat due to declining reimbursement rates and higher operating costs. In contrast, publicly funded clinics that adopt a physician-clinic model are demonstrating greater viability. By optimizing their workflow and leveraging the strength of trained team, these clinics can deliver high-quality care to a larger population. So what's the key takeaway? As physiotherapists, we must be thinking forward and proactively in response to these financial pressures. We can't afford to stick around with the status quo. Instead, we need to reimagine our business models with a focus on efficiency, effectiveness, and patient-centered care. By doing this, we can ensure the long-term sustainability of our practice and continue to deliver the quality care that we want to our patients. As we consider the future and our options, one model worth exploring is the physician-clinic model. Let's dive in and see how this team-based approach can benefit our patients and our practices. Section 2, the physician-clinic model. Teamwork makes the dream work. Have you ever wondered how doctors' clinics and dentists manage to see so many patients? It's all about the physician-clinic model, or it could also be called the dental team model. Just think how nice it would be to have a team of assistants helping you give quality care to more patients. Sounds like pie in the sky, right? It's not just wishful thinking. It's a present-day reality that's also paying dividends for many clinics. Could this be an alternative for you? I don't know. I don't want to overlook options here because you procrastinate. Insurance companies or governments will decide for you at some point, and they won't be asking nicely. Think about it, a team-based approach that you can use. See more patients, but not compromise on the quality of care. Remain financially viable in the light of declining insurance reimbursements. Focus on your high-valued tasks that demand your expertise. So it's time to change the way we deliver care. Are you ready to explore the physician clinic model and see how it can benefit your practice? At the heart of this physician clinic model is a team-based approach to deliver care. As the physiotherapist, you will lead the team of assistants that will perform parts of your treatment that they're trained for. This is typically one assistant doing hot packs and acting as the clinic support person, and another assistant supervising my exercise progressions and protocols. This structure will enable the physio to focus on aspects of care that require physio expertise, like a thorough assessment, developing individualized treatment plans, and skilled interventions like patient education or manual therapy. Wouldn't it be great if we could delegate routine tasks and focus on what we do best? You don't need a physio degree to put a hot pack on somebody or progress somebody doing a predetermined exercise protocol. So I'm assuming you have standardized evidence-based treatment protocols to make sure that the service delivered is consistent and quality, right? That was my second book. This is how my assistants can help me provide quality care without me having to count the exercise reps. Can you picture this? Let's look at what a typical day looks like in a physician clinic model. Start your day reviewing the patient list. I flag patients for reevaluation if it's been more than 6 weeks since their last reeval, or if there's something else fishy in their file that warrants a closer look. It pays to be prepared. Being organized makes the day go so much smoother. Have your assistants bring in the first wave of returning patients. My assistants are trained to flag any patients they think I should prioritize. Spend 5 to 10 minutes with each patient. We still get FaceTime with our patients. Each return visit is like a mini reassessment. This is where I scribble notes for myself about each patient visit. Then go write up these notes. Whether you write each patient note after seeing that patient, or you see 5 patients and then go write up 5 notes, that depends on your skill level and expertise. Leave nothing for lunchtime or the end of the day. Have a system to get your notes done as the day progresses. That's the only way to stay afloat. Do an evaluation. Write up that evaluation because you have a system, right? And then head back out to the clinic and meet the next wave of returning patients. And repeat. It's a never-ending stream of patients, and patients keep coming in and patients keep going out. People have these horrible analogies to a conveyor belt or a factory production line, but that's how the hospital emergency room works. It's how the physician clinics work. It's how my dentist works. They have a system to intake, triage, treat, discharge, and repeat. This is probably a different workflow than you're used to, but I've seen it work, and it works for the physio and it works for the patient. The awkward secret question becomes, how many patients can you see in a day? For these publicly funded clinics to be financially viable, physios need to see a lot, like 20, 30, 40 patients per day. What about more than 50 patients per day? With the right systems in place and a great team support, it's entirely possible to have high volume caseloads without compromising care. I've seen it work for myself. You can consistently provide great care while making the most of awesome assistance and smoothing out your workflow. Let's take a step back and break it down together. After rereading my script here, I came up with 6 potential flaws that you might be thinking. Let's look at these one by one. Flaw number 1, loss of personalized care or quality care. Isn't this the big one? We pride ourselves on delivering individualized face-to-face care to meet the unique needs of each patient. A team-based model need not lose that personalized touch. Routine activities can be carried out by support staff, freeing the physio to concentrate on high-value specialized interventions that directly relate to the needs of each patient, like patient education or manual therapy. But what about quality of care? More physio face time does not always imply better patient outcomes. The use of active exercise is the best predictor of positive results. While passive modalities, such as a TENS machine or an ultrasound, may be part of the treatment plan, the focus needs to stay on active, individualized exercise programs. Engage the patient in their recovery, and you get better outcomes. From the clinic management side, policy and procedures for quality of care using chart audits, peer reviews, and patient feedback. And great communication with your team improves care and improves patient satisfaction. Flaw number 2, insufficient training of support staff. Yes, support staff are not physiotherapists, but they can be trained to apply hot packs, supervise exercises, and fulfill administrative tasks. So you must train your team and mentor them. Over the years, I've worked with tons of assistants. Only a few have been useless. Most are good. Some are excellent. Hire smart people. Don't hire your cousins. Flaw number 3, Decrease patient satisfaction. Some patients may assume that everyone in the clinic is a physiotherapist. That's why we wear clear identification badges to distinguish our roles. Our support staff is trained to assist with specific tasks under the direct supervision of qualified physiotherapists. By clearly defining roles and responsibilities, we ensure patients receive appropriate level of care from the right person. While patient satisfaction can be influenced by many factors, it's important to remember that a team-based approach can lead to efficient and effective care. The key to success is providing compassionate and professional care to every patient regardless of the clinic model. Seeing a physio doesn't guarantee the patient will be happy. Flaw number 4, increased liability risks. A key concern when working with support staff is liability. Mitigating these risks requires a comprehensive approach including rigorous training, close supervision, and meticulous documentation. Strong policies and procedures combined with regular oversight can significantly reduce liability risks. Physiotherapists play a crucial role in supervising and mentoring both patients and support staff and ensuring the highest standard of care is maintained. Flaw number 5, resistance from physiotherapists. Some physios may worry that this team-based model could compromise their professional autonomy and lead to burnout. However, when physios take the lead in designing and implementing these models, they can maintain control over their clinical practice. By embracing a team approach, physios can reduce burnout and improve job satisfaction and provide a higher quality of care. By delegating routine tasks and working with trained support staffs, physios can focus on what they do best, providing expert clinical care. This not only enhances patient outcomes, but also allows the therapist to maintain a healthy work-life balance. Flaw number 6, regulatory and licensing issues. Navigating regulatory requirements can be a challenge when incorporating support staff into a physio team. However, being proactive with the planning and collaboration with regulatory bodies, you can adhere to regulations and clinics can successfully integrate support staff. By working together, we can create a more flexible and innovative framework for care to be delivered that benefits both the profession and the patients. Now that we've got a better understanding of the physician-clinic model, let's talk about how to make it work for you and your patients. Here are practical strategies to help you thrive in a changing world and provide the best possible care. Section 3, Thriving in a Changing World, 4 Essential Strategies for Physiotherapists. Navigating today's dynamic healthcare landscape can feel overwhelming, but if we stay flexible with our thinking and focus on our core mission of helping our patients, we can get through this. I have 4 strategies that'll help you cope. The first one is the 80-20 rule in physiotherapy. That was this video here. I'll give you a quick summary. Physiotherapy patients can be broadly categorized into 2 groups. About 80% of physio patients respond well to basic physio skills, and we can see measurable improvements in function and mobility within 4 to 6 weeks. These patients typically benefit from active exercises, patient education, and evidence-based protocols that focus on restoring function rather than just relieving symptoms. In contrast, about 20% of our patients have complex needs requiring a multidisciplinary approach. If you're the 3rd, 4th, or 5th physio seeing this patient for the same problem, they need something else. We all have these patients who are tough to fix, and they're not your average simple diagnosis that coasts through their physio visits. They're more like a complicated puzzle that requires a multidisciplinary approach. These patients might need a whole team of superheroes, doctors, nurses, psychologists, and even occupational therapists to help them reach their goals. As physios, we're the glue that holds this team together, and we need to be the superheroes who can adapt, advocate, and deliver results. It's like being the Batman of healthcare. We've got that awesome tool belt to tackle every challenge. So the next time you encounter one of these complex cases, don't be afraid to think outside the box. Collaborate with other professionals, advocate for your patient, and most importantly, believe in your ability to make a difference. After all, every superhero needs a sidekick or 2 to save the day. Second, the power of active treatment and patient education. So this is one of my catchphrases that I use all the time. Active treatments are more effective than passive treatments. Check out the video that goes with this. Plus, for your patients to succeed, they have to buy in mentally. Take a look at this other video here. We can sometimes forget that a big part of recovery is mental. If a patient isn't buying into your physio plan, it's doomed to fail. Here's the key. Ditch the passive treatments and empower the patient to take charge. Tell them what they need to do to move forwards towards their goals. Give them the exercises. Remember, education is your secret weapon. Explain to them that doing a particular exercise, not just what to do, but why they're doing it. This face-to-face time is gold. Address their concerns, keep them motivated, and if they understand the logic behind your program, they're more likely to stick with it and crush their rehab goals. Third, physiotherapy is multifaceted, and as practitioners, we must be versatile and flexible in juggling the various responsibility and roles that we have. Simplifying your approach is crucial for effective care in a complex environment. Here's a video that illustrates this concept. A simplified approach empowers patients by using clear language, minimizing jargon, and fostering collaboration. This leads to better compliance with home exercises and self-management strategies. Simplification also streamlines clinical decision-making by categorizing patients into broad diagnostic groups and focusing on key treatment stages. This efficiency is vital for busy settings and aligns with the 80-20 principle that we talked about earlier. Simplification also enhances communication and collaboration with the healthcare team. Clear documentation and concise language ensure that everyone's on the same page, promoting a continuity of care and optimizing patient outcomes. To achieve this, focus on plain language, prioritizing core skills and intervention, and develop a targeted treatment plan. By embracing simplicity, we can elevate our profession, enhance our patient care, and streamline our workflow. Lastly, teamwork is powerful. I know that sounds like a cliche business jargon, but it's true. Like going to my doctor's office, I check in with the front office admin staff, the nurse takes my vitals, and then finally I see the doctor. And if I need any tests, the doctor sends me to some tech. It's just a well-oiled machine. People do this because it works. It works for them, and it can work for us. Physiotherapists have much to learn from that. Having a team of qualified assistants will facilitate streamlining of our work processes, delegating responsibilities, and thereby allowing us to focus on what we do best, provide expert clinical care. The physician clinic model offers a solution to seeing more and more patients by leveraging the skills of assistants to enhance efficiency. The assistants free up the physio's time for high-level tasks like assessments, complex interventions, and by delegating these administrative tasks and routine duties and basic modality treatments and simple exercise progressions. This allows the clinic to see more patients without compromising service quality. Proper training, supervision, and clear roles minimize concerns about quality of care and liability risks. Strong protocols ensure consistent quality care. To effectively incorporate assistance into a practice of well-defined responsibilities, comprehensive training and supervision mechanisms should be established. Will transform Physio delivered with better access to care and maintained patient outcomes by embracing assistance. Teamwork enhances patient care, so take the time to consider how assistance can benefit your practice. In making this video, I was looking for an image to go along with the text, which is why I came up with these pictures. Pretty much every clinic puts up a team picture, and it's always a team that makes those clinics work. That's why I use these pictures. And that's why I need to shout out to all those clinics and all those assistants who make those clinics work. Speaking of teamwork, let's tackle a hot topic, the so-called physio mill. You know, these high volume clinics that some folks think can't possibly provide good care. Well, let's blow that myth out of the water. Bonus section, debunking the physio mill myth, how high volume clinics can still deliver quality care. As physiotherapists, we often wonder how to deliver quality care in busy clinics. The physician clinic model offers a solution by integrating efficient systems, team-based approaches, and patient-centered strategies to maintain high standards. Standardized protocols ensure consistency while allowing flexibility. Lean workflow and pre-appointment triage and embracing a copy-paste template note writing optimize efficiency. This frees time for focused patient care, reducing administrative burdens. This guy has been pushing this approach in business and in physician practices for a while, so it's not just me. For the best outcomes, it's important to educate patients in self-management and active home exercises. We reevaluate patients regularly and remind them of the importance of active home exercises. This allows patients to gain ownership on their recovery process. Effective communication with patients and our team builds trust and enhances overall patient experience. Over the past 30 years, I've been grinding away as a physio, and my perspectives have evolved. Some may consider my views unconventional, like nationalized healthcare and high-volume clinics, but they stem from my experience. I'm not here for shock value. I've come to realize that the traditional cash-based one-on-one model isn't sustainable. It may be working for you now or in the near future, but what about the long term? What about the other patients who can't afford basic physio care? That's why I create these videos, to spark meaningful discussions to support your dedication to quality patient care. The future of physiotherapy is uncertain, but we must consider the possibilities. Let's confront the elephant in the room. Insurance and reimbursement, funding will dwindle, and we need to innovate. Step back, see the big picture, and look at your options. I'd love to hear your thoughts. How do you see the future of physiotherapy? My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Time for an amazing video adventure, this one right here, and subscribe to receive delightful surprises with every new release. Thank you.